Therapeutic ultrasound (US) is an inaudible acoustic high-frequency energy that produce either thermal or non-thermal physiologic effects, with following therapeutic parameters. Frequency range 0.75 to 3 MHz, 750.000 Hz to 3 million Hz. Intensity 0.1 to 3 W, cm2. Depth of penetration 2 up to 5 cm. US is most commonly used as a deep heating modality in PT clinical setting. Physiological effects of ultrasound. Thermal effects. Continuous mode US of 0.5 to 3 cm 2. Those effects of ultrasound result from a temperature increase, 40 to 450 centigrade, due to friction among molecules in the tissues. 1 degree Celsius increase metabolic rate. 2–3 degrees Celsius reduce pain and spasm and increased blood flow. 4 degrees Celsius increase tissue extensibility and decrease joint stiffness. Increased pain threshold, reduction of pain and muscle spasm. Increased blood flow. Increased extensibility and deposition of collagen tissue. Increased enzyme activity. Increased tissue perfusion, oxygenation. Decreased nerve conduction velocity. Non-thermal effects. Using a pulsed mode. Duty cycle of 20–25%, with normal intensity. Using a continuous mode with intensities lower than 0.5 W per centimeter 2. Cell membrane and vascular permeability. Blood flow. Fibroblastic activity. Secretion of chemotactics. Stimulation of phagocytosis. Production of granulation tissue. Synthesis of protein. Edema. Diffusion of ions. Tissue regeneration. Principle of US production. Piezoelectricity is a natural phenomena found in many materials such natural quartz crystal or synthetic barium titanate. Direct piezoelectric effect. Creation of an electrical voltage across the crystal as it is compressed or expand. Reverse piezoelectric effect. When a high-frequency alternating current is applied to the crystal, causing alternate compression and expansion at each time. The current changes from positive to negative. This is produce mechanical sound. Frequency of US, 3 MHz. The higher the frequency, less depth of penetration and more absorption in superficial tissues. 3 MHz is appropriate for superficial lesions 2 to 3 cm such as plantar fasciitis, Achilles tendonitis, tennis elbow. 1 MHz. The lower the frequency, 1 MHz. The greater is the depth of penetration into deeper tissue. 1 MHz is effective for deeper lesion. Intensity 1 to 3 W per centimeter 2. The rate of energy watts is being delivered per unit of area cm2. Closing parenthesis dot. There are no definite guidelines for selecting specific ultrasound intensities during treatment. However, too high intensity causes tissue damage greater than 2.5 to 3 W per centimeter 2. Closing parenthesis. Lowest intensity achieves a desired therapeutic effect, is less than or equal to 1.5 WcM2. Mode of US delivery and duty cycle. Continuous mode of US is the continuous delivery of US energy over time that induce thermal effect. Used for chronic condition. Pulse mode of US is interrupted delivery of US energy over time that induce non-thermal effect, used for acute and subacute condition. Treatment duration. Dependence on frequency, intensity, size of treatment, area and thermal, non-thermal effects. 3 MHz at 1.5 W per centimeter 2 is sufficient to achieve a 4 degrees centigrade increase in local temperature of muscles per minutes 4–5 minutes. 1 MHz at 1.5 W per centimeter 2 is sufficient to achieve a 0.4 degrees centigrade increase in local temperature at per minutes 12 minutes. 1 MHz at 2 W per square centimeter is sufficient to achieve a 0.4 degrees centigrade increase in local temperature at per minutes 10 minutes. Treatment duration. Average 7 minutes. Range 5 to 15 minutes. Conducting media. A substance that facilitates the transmission of ultrasound energy by decreasing impedance at the air-skin interface. Characteristics of good coupling media. High viscosity and transmissivity for US. Hypoallergic character. Acoustic impedance similar to human tissue. Cheap. Lubricant. Indications. Therapeutic US. Acute and subacute traumatic and inflammatory conditions. 1 soft tissue injuries, sprain, strain. 2 painful shoulder. 3 bursitis. Chronic rheumatoid and arthritic conditions. 1 rheumatic conditions. 2 osteoarthritis. 3 rheumatic nodules. Wound healing. 1 venous ulcer. 2 pressure sores. 3 surgical wound. Scar tissue and contracture. 1 scar tissue, surgical and post-burn. 2 Dupuytren's contracture. 3 plantar fasciitis. Pain relief. 1 low back pain. 2 neck pain. 3 rheumatic pain. 4 phantom pain. Contraindications for therapeutic US. 1 rapid dividing tissues. Encourage neoplastic growth and provoke metastasis. Therefore, treatment over tumors should be avoided. 2 pregnant uterus. Not applying treatment over the pregnant uterus. 3 epiphyseal plates. Avoid giving ultrasound on cartilaginous epiphyseal plates because growth of the bone is impeded. 4 spread of infection. Bacterial or viral infection could be spread by US. The low-grade infections of venous ulcers. 5 tuberculosis. Risk of reactivating encapsulated TB. 6. Radiotherapy. Areas that have received radiotherapy in the last 3 months should not be treated because of the risk of encouraging pre-cancerous changes. 7 nervous system. Where nerve tissue is exposed, e.g. over a spina bifida or after a laminectomy. 8 specialized tissue. The fluid-filled eye retinal damage could occur. Treatment over the gonads is not recommended. 9. Implants. Smaller and superficial implants, low dose can be used. 10. Vascular problems. Circumstances in which hemorrhage might provoke should not be treated, such as hemarthrosis, hematoma, uncontrollable hemophilia. Severely ischemic tissues should be avoided because of the poor heat transfer and possible greater risk of arterial thrombosis due to stasis and endothelial damage. Recent venous thrombosis might extend the thrombus or disrupt its attachment to the vein wall, forming an embolus. Areas of atherosclerosis are best avoided for the same reason.